My name's Lynn Barrett. I'm the manager of Spark, which is Stockport Progress and Recovery Centre. We're a mental health charity. We're currently under contract with the local authority, although we do have a certain amount of money that is raised through funding applications. Favourite features? I think it's the reporting. Just being able to look at, right, okay, well, what do we want to report on today? Do we want to report on the activities that we have, or do we want to report on the attendance, or do we want to report on how many women have attended, or do we want to report on how many referrals we've got at the moment, how many are outstanding? It just goes on, and I love it, and I play all the time on it just to see kind of what the differences are, and really to help my understanding of where the service is going and how things are changing, so you can actually put in kind of key dates and you can compare kind of year on year and periods on periods. So I think that is definitely my favourite bit. The staff have really kind of embraced it. It's taken a little while, I've got to say, because we're all, like I said, with the number of us that have real difficulty with computers and databases, and I think after the initial kind of scare of, oh, we're inputting onto a database, it's enabled people now to be able to record their work and to see the real value of the input that they're having into people's lives, and it's taken an awful lot of that time-consuming work away. There's a search mechanism in it, so you can actually identify keywords and it will take you back to those notes. The actual reporting that you can gather, the report systems that are built in with CORS are really just what it says on the tin. The case outcome recording system just enables us and me as a manager to actually just gather reports about individuals or about a certain group or about the whole of the service, so that I can then report back to the people that are contracting us or are hopefully going to be providing us with any funding in the future, and also for the benefit of the service users. So it's really kind of, it's opened up so many doors for me. I'm not a computer buff by any means, but I've found it very, very easy to use, and it's just enhanced what we can actually provide. I can always provide anecdotal evidence, however when you've got actual report printing from a computer that you can't deny, it's just really been so enlightening for us. You know. It benefits the service user by us being able to be involved in their care planning, help them to understand that their involvement at the centre is part of a process, it's part of a pathway in their recovery. It's a very visual tool that we can actually work with the service user on. I think the difficulties really have been about kind of us embracing it as a team. Almost, you know, it's a bit, because it's IT based, it was very, very scary for some of the team, and for me, I've got to admit, you know, at first it was like, well, what can we do? Are we going to break it? There's those kinds of concerns. I think the actual recording hasn't been the most difficult part. It's just been really seeing the true value of outcomes. I think one of the best examples that I can give of how much of an easy system it is we've just recently had a couple of students, and I sat down with them and showed them how CORS could work and what we did with CORS and how to just do the basic information, and they were just absolutely overwhelmed and amazed by the system. They couldn't believe really that it could be so simple, and compared to all the systems that they've actually used in the course of their training, they just completely got it straight away. You can probably tell that yes, I would recommend CORS to other people. The detail that it can actually pick up on, and sometimes I can't even put it into words how beneficial that is to me as the manager. You know, before a contract monitoring meeting I can lift a report off about how many people have attended a certain group at certain times, what kind of people, you know, the age, ethnicity, gender, that in itself, you know, it's basic information, but it's very, very easy to just lift off the whole system, whereas before we'd be kind of hand counting, and we had a basic database before CORS, but it by no means was able to provide the report that we've now got. I suppose because I've not got a huge kind of background knowledge of IT, I wasn't aware of really what the potentials were. The way it's exceeded, I suppose, my expectations, if I did have any, is really the flexibility of the system. The way that we can adapt the outcome measures according to either the individual or the circumstances, or how we as an organisation wish to. So we can very easily put in our own Spark measures, you know, in a way that is service user friendly too, so that the service users can actually help us to identify how easy it would be to, or what the best way would be rather, for their participation and for their recovery to be recorded on CORS. So it's just that flexibility of us being able to input different measurements. We can use already kind of tried and tested systems, as well as inputting our own and developing as a team what those values are. Well, the challenges that we're currently facing are kind of changes in the funding streams and funding systems. We're becoming much more kind of focused on the introduction of personalisation, self-directed support. CORS, because it records all the activity that is involved within our service and that takes place within our service, and it comes up with the actual times and how long people have participated for, then we envisage that we will very easily be able to adapt the CORS system to really be a very useful tool in terms of us being able to get true kind of charges and true value to in a monetary way, the true value of the service. Self-directed support is quite a confusing process at the moment, and we're kind of learning along with our service users as to how we can keep Spark going in the future and really help the service users to be involved in that process as well, which is all part of our kind of ethos. The other part of it is that we will be submitting, or there'll be much more emphasis on us applying for funding from external sources. So having CORS will enable us to provide information in very quickly, very easy to read kind of methods that will hopefully instill confidence in our future funders or potential funders. Funding bids are always asking about what the outcomes are, what are the potential outcomes, what you're hoping for, what can we see if we give you this money, what will we get for our money really, which is quite right, you know, they're wanting to know what they're buying into, and we can very easily provide them with information that we're hoping this, and we can then back that up with evidence after a very short period of time throughout that kind of process of the funding. I think all organisations could benefit because of that flexibility that I've just been talking about.